actually see. Hold on.
All right. So hey everyone, my name is Ashley and I am the COO and Clinic Manager at Heart of Wellness in Tumwater, Washington. We are a collaborative group practice focused on healing for the whole you. Within our practice, we currently have 6 naturopaths, 2 acupuncturists, a massage therapist, and a dietitian nutritionist who form a dynamic group dedicated to your best health. So I'm curious who here is already a patient. I'm going to launch a quick anonymous survey to find out. So you'll see that pop up on your screen in just a second. There it goes. We'll give a minute for everyone to answer. Awesome. I'm so glad that anonymous person is interested in becoming a patient, and I'm glad that you're only here for the webinar. It looks like most of you are patients already, so thank you for participating and voting. I'm going to close that now. And let's see. So with this amazing and diverse group of clinicians and our incredible staff of patient, clinical, and financial care coordinators, we are able to help people of all ages and stages in life throughout their whole cycle of care. Heart of Wellness recently launched a fully HIPAA-compliant and secure video telemedicine program. These visits are billable to insurance, and many of our patients are utilizing this method of care during the Stay Home, Stay Healthy order in Washington State. Have you ever had a telemedicine appointment? I'm going to have one more quick survey before I hand it over to Laura and Dr. Schuster. If you could let us know your familiarity with telemedicine by choosing an answer on the survey that's going to pop up on your screen. In just a second here. All right, there it goes. So have you had a telemedicine appointment? Do you have one scheduled? Did you have one and you didn't like it? Or have you never had one? All right, awesome, everybody, thanks. So it looks like about half of us have had one, someone's got one scheduled, and some of us have never tried one. So I definitely would encourage you to give it a try. If you joined this webinar, which you all have, you can definitely have a telemedicine appointment. All right, so Laura Woodworth and Dr. Schuster. Laura Woodworth is a registered dietitian and nutritionist who received her Master's of Science in Nutrition from Bessier University in Seattle, Washington. She finds her role to be in guiding you in your journey towards greater health, energy, and clarity, whether it is to help explore and implement dietary changes or to find the places in your life to affect that change. Her holistic approach means together you will look at all aspects of wellness, body, mind, and spirit. Each part contributes to the health of the whole. And next, we have Dr. Morgan Schuster. Hi. Dr. Morgan Schuster is a licensed naturopathic physician who received her doctorate in naturopathic medicine from Bessier University in Seattle, Washington also. Dr. Schuster's approach to medicine is to assess each patient as an individual, keeping their whole health in mind, including their mental, emotional, spiritual, and physical well-being. Her emphasis is preventative medicine with a strong foundation in nutrition and lifestyle modifications. She utilizes a combination of conventional therapies as well as botanical medicine, nutraceuticals, vitamins and minerals, pharmaceuticals, homeopathy, and hydrotherapy. Dr. Schuster believes that each person's unique story needs to be heard in order to get to the root cause of their ailments. If you have any questions for me, Laura, or Dr. Schuster, enter them into the chat. We may answer them in the chat or later in the talk. If you have technical questions, shoot them out in the chat too, and I will help you as soon as possible to help you find a solution. And with that, I'm going to turn off my camera and my mic and turn it over to you lovely ladies.
Oh, great. Thank you so much, Ashley. We appreciate it, and you and all of our participants today as we have this kind of candid conversation. I'm so happy to do this talk with Laura. She's wonderful, and we're going to just talk about things that we love and are passionate about in terms of nutrition. I'm so happy that this actually follows a talk that was previously done this week with our acupuncturist and functional medicine provider, David, who talked about Prolon. And if you didn't hear that talk about intermittent fasting and for health promotion, after you're done listening to our talk today, go and listen to his. With a lot of my patients who are interested in jumpstarting weight loss or fasting for longevity or for other health purposes, Prolon's an awesome option. But what's really important is also finding a diet or finding a way of eating, a nutrition plan that's going to be sustainable for you. Something that you can do for the rest of your life foreseeably. And so following the anti-inflammatory diet guidelines that we're going to talk about today is just a great way to transition out of doing a fast like Prolon and finding a nutrition plan that you can do for the foreseeable future. And both Laura and myself, we teach it, we encourage it, and I'm just really happy to dive on in. Everyone can see the slide, my slide, correct? The anti-inflammatory slide?
Yes.
Great, perfect. All righty, so what is healthy eating? Laura, what do you think about when someone mentions or maybe asks you, like, what does it look like to eat healthy, or how can I eat healthy? What comes to mind for you?
Well, for me, it's a big question. It really depends on each person. I think if people are feeling good after they eat, they don't have bloating, they have energy, they're feeling good, then that's a very good sign that they're probably eating healthy for them. Mm-hmm. It gets deeper than that, but I do think that the eating in a way that helps to promote anti-inflammation, I should say the opposite way. How do I say that? Eating in a way that promotes less inflammation, still the same thing, is a real baseline for everyone, because so much of our standard American diet is foods that are inflammatory.
Yeah. I would absolutely agree with that. That's kind of a similar response that I would have. I personally really like this quote from Michael Pollan. I think that it kind of encapsulates what we're going to talk about today and just healthy eating and what that means. Mm-hmm. And it's very individual, like you said. Everyone is going to be a little bit different for what's eating healthy for them. But if you're following more of an anti-inflammatory or a whole foods approach to your nutrition, it can be really beneficial. So with him, he's saying eat food. So eat real food, fruits and vegetables, whole grains and fish and meats. But you're eating that whole food, the food that you see in front of you. Mm-hmm. And not these. So Michael Pollan refers to these edible food-like substances. So these foods that maybe you find in a box or a bag, and you're like, what is this? Where did this come from? You're not really quite clear about that. And so that's what he means by real food or eating food. And we'll talk about that as well today. And my premise and things that I like to talk about when I'm mentioning nutrition changes with a patient is talking about foods to encourage versus avoid. So a lot of the things that we're gonna talk about today maybe are foods that you've never tried before, but they're foods to consider encouraging versus we're not going to spend a ton of time on foods that you should avoid for these purposes.
I think that's nice. I wanted to also interject, besides just focusing on what we're eating, it's also a really nice thing to consider how eating things that you enjoy, if you're just only eating vegetables all the time and you're not really enjoying the vegetables, then that's it's not as healthy, if you will, as eating something that you're really enjoying eating. So then that comes into mindful eating, but I just wanted to put in a plug for that piece also.
Yes, absolutely. and really focusing on the food that you're eating. So making sure that you're chewing the food really well and you're enjoying the flavors of the foods. And you have great tips and tricks on how to do that. So we'll get into that in a little bit. All right, so you're probably also wondering out there in the audience listening in, what is in this talk for you? Well, there's going to be a lot of cat pictures for one thing, so hopefully you have a couple cat fans out there in the audience. But the big things that we're going to talk about today, and what you're going to hopefully get out of today's lecture, is what are anti-inflammatory foods and why are they so beneficial to us? And then what foods to potentially encourage to help to promote health and prevent disease, and what foods have immune supporting properties. So with everything that's going on right now, a lot of people are wondering about how can we support our immune system. And a wonderful way to support your immune system is through nutrition and through eating, an anti-inflammatory type diet. And we'll talk about the immune system and its role in nutrition. And I've given this talk, just a little background about me, but I've given this talk for oncology groups. For a number of years, I've worked with Swedish and Northwest Medical Specialties, a couple of clinics in the area, and worked with oncology patients, and we talk a lot about nutrition. And there's a lot of research out there on nutrition for people that have been diagnosed with cancer, and foods to help promote the immune system, especially for someone with a diagnosis of cancer or a past medical history, or they want to prevent cancer. Fasting is one way too, to help prevent and help with cancer. I won't go into that today, but a lot of the research on nutrition is from an oncology perspective, and with patients with cancer. So we're going to talk about, when we mention the immune system, we'll be referencing throughout a little bit about cancer, and there is some correlation with what's going on right now with COVID. It has some similarities in how it works in the immune system as some certain oncologic diseases. So we don't have any research as far as we've looked, in terms of nutrition in COVID situations, but we can extrapolate and we can kind of make some assumptions on how to eat to support your immune system based on what we know from the studies that have been done in cancer patients and in oncologic conditions. So with that being said, we're just going to clarify and talk a little bit about what is inflammation. What do we mean by inflammation? Laura, do you have any thoughts on this? How does a nutritionist think about inflammation in the body?
Well, Dr. Schuster, I feel like I know that there's two different kinds of inflammation that we're talking about. There's the acute inflammation that happens like when you get a little infection in your skin, or you have an initial redness. But then there's the chronic inflammation, and that's really what we're talking about when we talk about eating anti-inflammatory foods. Is we're looking not to reduce the inflammation in your little cut, but the overall inflammation in your body, because it's sort of like this. I can't think of the right term. It causes more and more inflammation. The inflammation starts and then it keeps going and it turns into a chronic thing, and usually a lot of the conditions that we get that are chronic have an itis after them, like tendinitis, bursitis, gingivitis, gastritis. So you know that kind of means inflammation.
Yeah.
That's what I think of when I think of inflammation.
So it's a similar diagnosis or similar characteristics as a doctor would think about it. Yeah, and some of the acute situations of inflammation, we see redness, we see heat, we see swelling, we feel pain, and that's the definition of inflammation. And then as that continues on and on over time, we get into these chronic situations. and that's when we need to intervene. And because in those chronic situations, when there's inflammation that's been going on for too long, that's when we start to see cellular changes. So the immune system starts to change. And so, you know, that's what's also taking place with some of the complications that we see with COVID right now, is that the inflammation that's taking place in the body is too much for it to handle. And there are certain conditions that people are a little bit more predisposed to having more inflammation, more of the chronic type of inflammation, where we see the cellular changes such as obesity and diabetes and certain cardiovascular conditions. And there's other health conditions, like you mentioned, any of the itises.
I do want to say that people can be obese and not have a lot of inflammation and be pretty healthy. Yeah. I just want to put a plug in there, because you can be healthy at every size.
Yeah, thank you for saying that. Absolutely. That's very true. So again, it's a very individual. So we're making some really general terms claims here, but that it is really, you know, when you look at nutrition and when you look at promoting your health and reducing inflammation, it's really going to be an individual situation. And that's why, you know, meeting with someone that can kind of direct them is really helpful. All right. So this is kind of what we've been talking about in terms of the immune system overreacting to itself, and in more of an inflammatory state, we see cellular changes, and a lot of it has to do with the cytokines in our body, which is an immune player, and it can affect all different areas, and particularly in COVID, that's what's taking place. All right, so let's dive on in to the anti-inflammatory diet, and what does it mean, and why is it going to benefit us? So we are starting to kind of understand why a diet can and will reduce inflammation, and especially one that's nutrient dense. So we're going to start talking about the first nutrient category, are complex carbohydrates. And why are they so important to encourage? So Laura, do you have any thoughts on, you know, complex carbohydrates or carbohydrate intake, why they would be more important or to encourage for people?
Well, we're going to talk about it in a couple minutes, but if you look at it in terms of the glycemic index, which we'll see a slide about, you can see that a more complex carbohydrate has longer chains of glucose within them. So, and there's all kinds of other things in there. So it takes your body more energy and time to break those apart into simple sugars. And that means that your body's initial response is, instead of a boop and a boop, it's more of a, do you like my sounds? It's more of a boop, you know? So
those sounds exactly.
That's the bottom line. When you think about why you eat complex carbohydrates, it's just and you get so many more nutrients from those foods because there's just all kinds of things built into the structure. And when you eat a simple carbohydrate, it's just, you know, glucose and a few other things. So
yeah. So exactly. So some foods in our body, so some carbohydrates in our body, or those simple carbohydrates, they cause our blood sugar to spike really quickly and really fast. And there's a time and a place for a lot of those simple carbohydrates, especially if you're thinking about running a marathon race. You want that quick energy. But for most of us, we're not doing that all the time. And so we're looking for carbohydrates that are going to slow that big glucose spike and kind of prolong our energy, our mood. And so those are the complex carbohydrates. Not to mention that those complex carbohydrates, they make that glycemic index, that jump, less, like I said. And when we see jumps in our blood sugar, those big spikes, especially with higher glycemic load foods, it actually causes more inflammation in the body. And specifically with those cytokines kind of react as a result of the simple carbohydrate. So here are a bunch of different foods and the amounts. Can you explain this a little bit more, Laura, for us so that we understand these numbers and what they mean?
Yes. So the glycemic index, each food individually was tested to see how quickly our bodies broke it down and how fast it would go into our bloodstream as glucose. So 100 is straight glucose, and 1 is, well, I don't know if there is anything that's a 1. Maybe it would be like a fat. So this nice picture, the outside are foods that maybe just to kind of don't maybe avoid if you're doing an anti-inflammatory diet, because these are the foods that really spike your glucose levels. And then the yellow in the middle, those are kind of in the 50s range, 50s and 60s. Those foods maybe a little bit sometimes, or just not by itself, right? Like beets are on there, and I eat beets all the time, but I also eat them with seeds and nuts, for instance. And then the middle, the green, that's the stuff that is a lower glycemic load. So I think that's pretty clear. There's like broccoli, and I think I see a sweet potato that's a number 48. So that's great. Sweet potatoes are great, and squash is in there. It looks like. But then I see a pumpkin. Okay, go ahead.
Oh no, those would be the foods to think about encouraging. So would you generally say in that yellow, green range are the foods that someone in a more anti-inflammatory type diet would want to encourage?
Yes, I would say so. And if you need to have something in the outer ring, I think just pairing it with something else, like a protein or a fat, helps to take that glycemic index number down, the glycemic load. And I think that's one reason why we don't talk about the glycemic index a lot, kind of in a public way, because I think nobody ever eats just some pumpkin. Nobody ever eats, well, some people, I guess, do eat just bread, but usually maybe you put some butter on it, right? So say you had a piece of this French bread here, number 95 in the red, you had it by itself and it might have a 95 glycemic index number, but with a little butter on it, that might bring it down, to be a lower number. And who really ever eats one thing alone? So it really, you can eat these things. I don't want you to not be allowed to eat them. Just think about eating a protein and a fat along with it.
To slow that glycemic index, absolutely.
Right.
Yeah, slow that spike down. Yeah, that's a good point. And we'll go into those foods in a moment. All right, so these are if you think about some really complex carbohydrates to consider encouraging, these are more of the gluten-free grains, and that are often encouraged in an anti-inflammatory type diet or lower inflammatory diet. And these are whole grains. These are my favorites. And although this cat doesn't really like the quinoa, I do like the quinoa and the buckwheat and the oats, amaranth, millet, legumes. These are going to be the foods that are going to be the lowest on the glycemic index, and therefore have more of an anti-inflammatory response in the body. So it's going to reduce some of the inflammation. But like Laura said, it's all about, what you combine on your plate, and what that looks like. And we'll go into that in a little bit.
It's sad that this cat does not like the greens, but I guess it makes sense.
Yeah. Yeah, it's not something you think about feeding to your cat, but I do love that grumpy cat.
Me too.
All right. So fruits and vegetables, probably, I don't know, that's definitely a naturopathic doctor's favorite thing, are fruits and vegetables. And I'm just telling people all the time to encourage lots of fruits and vegetables. And they just serve so many properties in our body. They help to stimulate the immune system. We know that, and we'll talk about some in a little bit, that do a really good job with stimulating the immune system, and they absolutely reduce inflammation. They also prevent DNA damage and promote cellular repair. And that's pretty darn incredible that fruits and vegetables actually can change your DNA. I'm just going to pause for a moment because it really can affect you and your body, and preventing DNA damage. So Yeah, not a lot of things can do that. They regulate hormones, and there's certain phytonutrients that we'll talk about in a little bit, in certain fruits and vegetables that actually do modulate your hormones. And they, I think we're missing a word, but they decrease some comorbidity, some issues that may happen in certain inflammatory conditions and chronic diseases. And my tip and trick with fruits and vegetables, I actually generally encourage people to cook their fruits and vegetables, just because it makes it easier for them to digest. Do you have any thoughts on that, Laura? What do you tell people with fruits and vegetables?
Well, sometimes people will be they'll know that they should be eating a lot of fruits and vegetables, and they'll have this idea that they are, but then when they start looking at the ratios of food, I mean, it's a challenge to fill up half your plate with vegetables, and a salad is kind of less dense, so that's kind of nice. Although I think eating raw vegetables is a good way to go, but a mixture of both cooked and raw, because some nutrients are cooked out, and some are cooked are better cooked.
They're more easy to digest. You're able to get some of the nutrients out of those vegetables when they are cooked.
Yes, exactly. But I also think that having a slaw, because a lot of people are like, ooh, salad's I just don't like it. It's too fluffy. It doesn't feel like I'm eating anything. So trying different methods of grating vegetables and putting them together with a dressing is another way to get more fruits and vegetables that is often overlooked.
Yeah, that's a great idea.
Slaw.
Absolutely. Slaws or different toppings that are vegetable dense, sauces like pico de gallo, I think about too.
That's
and, people add on. That's yummy.
Whatever it takes to get those vegetables inside your body.
Yeah. I generally tell people to have like 7 to 9 servings per day, which sounds crazy, but every fruit and vegetable is going to be a little bit different in terms of the amounts to encourage and those serving sizes. What do you tell people in terms of how much they should have with fruits and vegetables?
Well, unless they really need me to get more specific, I try to look at the whole day and talk about, like, if you took all your food from the whole day and put it on your plate, is it taking up half of the space that you're eating? And then, in terms of portions, like one medium-sized apple is 1 serving. I think it's 2 cups of spinach loose is 1 serving. So you're right, they're different. Some more dense vegetables can be like 3/4 of a cup. So I guess that's all I would say. Yeah.
So it's going to depend on the fruit and the vegetable. Yeah. So basically it's just the idea to encourage them.
Right. Because you can't eat really too much. I mean, maybe too much raw, kale and but really it's rare. Most people, you could need enough. Just keep eating it. Grab it from the garden when you walk by, snack on it, whenever, put some peas on the fence and just eat them. So,
That's great. Perfect. All right. So fats. I have patients ask me all the time about fats, and a lot of times I just tell them, well, encourage the plant-based fats. Those are going to be and the fats that are higher in omega-3 content, and the anything that is in a box or a bag are going to be their omega-3 content. Their essential fatty acids are going to actually be stripped in order to preserve their shelf life. So that's why Michael Pollan said eat the real foods, and why we're going to encourage, especially for more of an anti-inflammatory approach, to eat the real foods, but not worry about the healthy fats, the plant-based fats, and just encourage them. And so I love hearing a perspective on fats from a nutritionist like Laura. So I'm going to let you talk about fats and kind of what you tell people about eating fat, and is fat going to make me fat, and those concerns there.
Well, that's a lot to talk. That's a
whole lecture,
right?
A whole webinar.
I really think that the things that you're talking about are really accurate. And I love the way you talk to people about this stuff, because it doesn't need to be overwhelming. But there is research that shows that diets high in saturated fat and trans fat are pro-inflammatory in nature, and that a diet high in monounsaturated fats can help reduce inflammation. So, I mean, we know this. There's no question that we should try to eat the monounsaturated fats like avocado,
olive oil.
Yeah, the ones that you've already mentioned. And sorry, I don't have my nice list here. So, and I also think that eating fat doesn't make you fat. We know that the way we digest foods is that usually it's those very processed, high glycemic index carbohydrates that actually help us gain weight, because we're just taking in all this intense energy, and then our sedentary lifestyles, like you were saying, we're not using that energy. Yeah. So, I mean, if I was running, 3 times a day, a couple miles, then maybe, I could eat that processed carbohydrate and not gain weight.
Yeah.
Really finding a balance. Right. So it's not the fats that are making us fat at all, or even raising our cholesterol levels. So
And then what are your thoughts in terms of the ketogenic diet? I mean, a lot of people ask me about when we think about fats or diets that are higher in fat, that we think about the ketogenic diet.
Right.
And I know some of your thoughts on it, and we share similar thoughts and ideas on the ketogenic diet, which is a diet that's going to be higher in fats. And what do you tell people that maybe are interested in the ketogenic diet or want to do something like that?
Well, I mean, just to take a step back, first of all, I think the ketogenic diet is something that is a temporary situation. Like if somebody wants to try the ketogenic diet for maybe a month, 2 months, 3 months, but I think after you get past a certain point, it's time to pull it back in and kind of get all your macros again. It's not something that's really sustainable. And there's a lot of different things that happen in your body over time. But the other thing I would do before I thought it was a good idea for a patient is just listen to them and see if they've tried a low carbohydrate diet, how it made them feel, how they feel when they eat fat, whether they have any kind of digestive issues with fat that maybe they don't recognize. And thinking about, do they have diabetes? Do they have prediabetes? There's a lot of different things that you need to consider before you go for it. And then the ketogenic diet itself, I feel like there's different ways to do it. And if you're just going to jump in and eat a lot of bacon and butter and red meat, then absolutely not. But if you can be enough in control to really eat at least half your plate of vegetables or more with the ketogenic diet, then I think you should go for it if you can eat those healthy proteins and the healthy fats.
Yeah.
But I think it's important to have that conversation before you jump in, because it's a big shift, and it's not a good idea to eat that much animal product. Red meat,
so it really is the ketogenic diet. My understanding, it's a lower protein, but a high fat and a low or moderate protein and low carbohydrate type of diet. So it could be something, good for certain people in certain situations and for maybe a certain amount of time, but maybe it's not the most sustainable diet.
Right.
And even, doing it for a short amount of time to help promote weight loss or certain conditions, but then switching out and doing something like the anti-inflammatory diet for the rest of your life, or Mediterranean-based diet.
Right, Mediterranean. That's what I was going to say too. And I do think that, I don't want to just say generally it's short diets, weight loss diets are a bad idea, because I do think that there's a place in our lives for doing a short-term kind of not a fast exactly, but like intermittent fasting, or getting kind of a control of what we're eating and being aware of what we're eating, and maybe doing a 12-day kind of a thing, or something that really helps you see that you can control what's happening in your body and you can notice how you feel, and knowing that it's temporary and that after the temporary, you're going to take what you learned from that and apply it to your diet, right?
Yeah, exactly.
Yeah, I don't ever want to be one of those dietitians who's like, no diets ever, because I do think there's a place, but it's more of a psychological process. It's important to come at it from a awake perspective and go, I know that I'm not going to do this diet forever, and I know it's probably not going to make me lose weight that I'm going to keep off, because it's more about getting control and then moving forward with what you know works. Anyway.
Yeah, control or teaching or kind of knowledge.
Yeah, knowledge. Maybe not
how
control.
you feel with food and how it affects your system. And
a deeper understanding.
And a relationship with food.
Yes.
That's kind of what we're always teaching too, is that awareness. I just want to mention, some of those monounsaturated fats or some of the healthy fats to encourage that I tell people to do if they're going to eat fats would be, the olive oil, the avocado oils, the avocado, coconut oil, ghee, and then those cold water fish. And the cold water fish are lower in the heavy metal content. So those are like salmon, mackerel, anchovies, herring, sardines.
Oh,
what were you going to say?
I'm sorry to interrupt, but the smash fish, let's see if I can remember each letter. Sardine, mackerel, what's the A? Anchovies, salmon, and herring. Those are like the best fish to eat, the smash.
Yeah, exactly. So hopefully we have some people that like fish out there. And then protein. So protein is so important, for helping maintain our muscle mass, and energy, mood, sleep quality. The list goes on and on. And it's, I give out this is the only time that I actually am really clear with patients in terms of how much protein to eat based on their size and their activity level, because not everyone is eating quite enough protein. And you can encourage protein on an anti-inflammatory type diet, but you don't have to think about protein just in terms of meats. Protein comes in all sizes and isn't just from animals. It's nuts and seeds. Complex carbohydrates contain protein, and the cold water fish. And then I like to encourage more of those wild game meats. If you have someone that you know who maybe hunts, and they can get you some of the elk, that's going to be just a better quality meat potentially, a leaner meat, and less in the saturated fats content. What do you tell patients about protein?
Well, you really nailed it. I think eating a really good lean meat and trying to eat a smaller portion, like a good portion to have just maybe 3 to 4 times a day, is like deck of card size protein. So whether that's tofu or elk or fish, or even, nuts, that's a different kind of a serving size, but it's good to vary your protein too. And if you really love red meat, maybe have it just once a week, twice if you really, really, really have to, and then try to maybe shrink your portions down, because we don't absorb a lot of protein at one time anyway.
Yeah. That's interesting. I haven't thought about it, but yeah, protein is a large molecule, and it's hard to always break it down and digest and absorb it in our body. So doing the smaller portion sizes with protein makes a ton of sense to me, because it allows our system to break it down a little bit easier. And a lot of people have reactions to protein, different protein molecules, whether that's casein or whey, or it's the protein molecule that people are having an issue with when they have some intolerances or sensitivities to foods.
Right.
So making smaller protein sizes makes a ton of sense.
And chewing your food too. Again, bringing that up, like it's so important to chew your protein food because you're getting ready for just the next stage, to start to break apart that protein. So you need to signal your body it's coming,
Yeah, exactly. All right. And fiber. So most Americans, this shocked me, most Americans only get 10 grams of fiber per day. No wonder we're all constipated. I mean, so we need to try to get at least 20 to 30 grams per day of fiber. And there's lots of different ways to encourage fiber through foods and fruits and vegetables. And I listed some of my favorites, especially those fruits and vegetables that encourage a nice poop. But poop, I mean, naturopathics love to talk about poop. Probably nutritionists do too.
Yeah.
Because it's a sign of your health, your intestinal health. And who doesn't feel like great after a great poop? I mean, I don't know. Who doesn't? But yeah, that, I mean, it's a sign of a good digestive system if you're able to make a healthy poop. And pooping and fiber in particular, fiber binds to toxins and excess hormones, and it helps to carry it out of the body. So I just say again, encourage fiber, encourage those fibrous foods. What do you tell people in terms of fiber and how to encourage fiber? Because it's hard for some people.
It is really hard. I think but it goes along again with the trying to eat enough vegetables. If you can get up to that level that we're talking about, like say you could get to 9 servings of vegetables a day, and you're eating those whole grains, at least more than, I mean, I think the standard thing is more than 50% whole grain, but I really think we should aim for more like, 80% of your grain should be whole grains. Then you're going to be getting enough fiber. There's a lot of fiber in those foods, and drinking the water, and I think that's the way to get it. But if you need to add fiber because you're having a hard time getting enough of those high fiber foods, then it's worth getting some extra fiber to add, maybe to a smoothie or something.
Yeah. I like chia seeds or flax seeds for some people, but then fiber is hard for some people. So there are certain situations where, again, fiber may not be right for them at this time in their life. And there's certain conditions. So again, fiber is going to be very individualistic. It's really going to depend on who you are and what your digestive system is like, and what fibers, foods to encourage or not, just depending on your overall health picture. So although we're making some general terms here for some people, in terms of recommendations and goals, again, it's going to be very, it's best to meet with a nutritionist or a naturopathic physician, someone that's knowledgeable in nutrition and understands your body and what's going on there, to give some of these recommendations about. All right. So I'm hoping no one feels at this point that this is what their plate is going to have to look like from now on in order to eat healthy. I hope they have some better ideas out there. And this is an example from Bastyr. I mean, we both graduated from Bastyr. We have love for Bastyr, and they created this healthy plate model. I think our nutrition group. So Laura, do you want to talk about this a little bit?
Well, it's fairly self-explanatory. We can take a look at how different it is from the MyPlate. If anybody has used that as a tool, this one has focuses on whole grains. And it also talks more about healthy proteins. You can see the fish down there, and it looks like edamame, kind of the little beans there, and eggs are a good protein source. And then it also talks about having water instead of the dairy. And the dairy is not necessary, as necessary as you might think from looking at the MyPlate. Although it is a good source of calcium if you tolerate dairy products, and good healthy whole fats too if you're eating those whole fat dairy products. And it talks about you can maybe use your fruit as a dessert, which I've always loved that they mention that, because I think sometimes we forget that fruit is so sweet. It can be our dessert, like when we're trying really hard not to eat processed sugars. Maybe we save a special piece of fruit for after dinner. Instead. I'm just kind of throwing out ideas here.
And the digestives. We didn't really talk about digestives.
No, but that is really a good thing, especially that's very anti-inflammatory in our system. If we find some fermented things that we love to add, do you want to talk about those too?
Yeah, so people ask me all the time about probiotics. Should I take a probiotic? And I generally tell people to encourage probiotic-rich foods. So those are the digestives. So those are things like sauerkraut, yogurt, miso, kimchi, kombucha, sometimes kefir, and other fermented vegetables, because and you want a variety of the different probiotic and prebiotic strains which are in some of those foods. And so I generally, for most people out there, encourage a little portion of that to help you digest your food so that you can get the most out of the food that you eat. It helps you digest and it helps you absorb the nutrients.
Plus, it adds really great flavor. If you find some like local sauerkraut and just throw that in, you can add it to your dressing, or you can use the juice. I forgot what it's called. What's it called that it's floating? I
want to say starter, but it's
not. Yeah. Just a really tasty thing to have for flavor. And a lot of people have a hard time getting enough flavor when they're switching to more of a whole foods diet because they're used to more processed food with sugars and salts that, make fancy flavors in their mouth.
Yes, that's a really good point. Absolutely. And so that's what you're great at doing, is telling people, kind of directing them on how to make their food taste good so that they want to encourage these fruits and vegetables and whole complex carbohydrates and whole grains. Now, interesting. So we went away, we didn't say this, but America, I think, has gone away from the pyramid model of food, and we now have more of a plate model. And this is Canada's plate. This is their healthy plate, which is the new food pyramid. And I just think it's awesome. It's beautiful, and thanks, Canada. It shows us that, half the plate, again, is fruits and vegetables, and that's what you're trying to encourage. And then you have some proteins, some complex carbohydrates. They show us the quinoa there and some of the whole grains, and a little bit of those simple carbs like in the pasta and the bread.
Look at all the colors on this plate. I mean, it's even just in the protein, there's so many different shades of brown and gray and, well, not gray.
Yeah.
There's no. Yeah. So that's really nice to see. And the textures in the whole grain foods are just beautiful.
They are. Yeah. All right. So I think we're starting to get a little bit that certain foods can reduce inflammation. They can boost your immune system in that whole process. And then there's other foods out there that can feed inflammatory processes, can potentially propagate certain carcinogenic situations because it's leading to and promoting the cellular division, the uncontrolled cellular division. So the immune system kind of going rampant. And we didn't go into all those foods, but we kind of alluded to some of those. So that's just a nice quote that I like about food. So let's talk a little bit more specifically and break it down for everyone, why certain foods and how certain foods really do support the immune system. All right. So it is the bioactive compounds. So certain vitamins, minerals, phytonutrients that influence our genes, our DNA, and therefore affect our immune system. And they've done a lot of research. This is the research into nutrition and cancer, and this is what they've shown. It's those bioactive compounds. Laura, do you have any thoughts on this?
Well, you and I were having a conversation trying to figure out the difference between phytochemicals and bioactive compounds, because we hear both of those terms interchangeably, and I just wanted to clarify. Phytochemicals are simply chemicals produced in order to protect themselves. So like, I think a good example would be, the one that's in broccoli that's so good for us that we talk about a little bit later,
Diindolylmethionine.
Right, those are things that the broccoli has developed to protect itself. And so that's why when we eat those broccoli sprouts, we get like the same amount of that thing in a broccoli sprout that we would get from that whole plant, just so interesting to me, because it's like all within the plant when it all of its DNA just makes it. And then bioactive compounds are plant or animal-based compounds that have health benefits to the human being, like you were saying. So this is more of the human perspective when we call them bioactive compounds. So some bioactive compounds are also phytochemicals depending on their source. And I've always found that fascinating, that the antioxidants that are so good for us, they're actually the plant's way of defending itself and protecting itself.
Exactly. Yeah, exactly. Yeah, which is pretty darn incredible. And that's what's going to benefit us, because it teaches our immune system how to respond to stress from the environment. The plants have created these things in them to help them deal with stress, and they're able to translate it to us. And plants, fruits and vegetables and herbs do the same thing. And we kept saying, look at how the beautiful color is on the plate. And again, you want to encourage the rainbow when we eat lots of fruits and vegetables, different colors, because it's all those different colors, those reds, those greens, those yellows, that are going to have the different phytonutrients. We're going to go into a lot of that to break it down for you in a moment. But you can see in this slide how, the oranges have some of the carotenoids, and whites have the allicin, and then all the dark berries have some of the flavonoids, as well as other components that we'll talk about in a moment. Like in cherries, which has a lot of antioxidant properties, and also has melatonin naturally. It has quercetin, which is a wonderful nutrient that helps with allergies and inflammation and the immune system. And the anthocyanin, that's the flavonoid component, this polyphenol that helps our system dealing with stress and some of the phytonutrients in it. And it's the allicins that give the cherries the deep red color that is believed to be good for our heart, for instance, and our cardiovascular system. And cherries can offer the heart and surrounding tissue protection, as well as inhibit plaque formation. And so it's a very, very powerful antioxidant. I love that cherries also contain higher levels of melatonin, and melatonin is that hormone that helps us with sleep and that involved in our sleep-wake cycle. And there was a study on that. So even just a little bit of cherry juice around bedtime can help you sleep better. And sleep, we know, is so important for our immune system to function well. And I'm sure you guys can think of so many other fruits that have that yellow, the anthocyanin component, red component, like cherries. So we'll go into a couple other examples. Do you have any thoughts on that, Laura? Kind of the reds?
I was just answering a question on that. I hope that's okay. On the reds, did you mention the carotenoids? And
not yet.
Nope. They're more with the broccoli, right? I just wanted to mention a couple of red fruits and vegetables that maybe we hadn't thought of. The new tomatoes have red skin, so you'll find those things with those. Sweet red peppers, even rooibos tea, which I always say wrong, has really some of those same great antioxidants. Phytonutrients. And strawberries, red grapes, red grapefruit, raspberries, even radishes, pomegranate's a great one. Kidney beans have some of those same things. So it's really a variety. It's not just only, fruits or vegetables. There's other things in there.
Yep. Absolutely.
Okay, that's all I got.
Yeah. That's okay. All right, broccoli. So I think broccoli is probably one of my favorite green vegetables out there. I just think it is wonderful. And when you think about your mom saying, eat your broccoli, I think she had, she was talking about something there. She knew maybe more than what we realized. So I just want to show this cute video for a moment. Hopefully it will load and we don't have to watch too many ads.
The fasting mimicking diet is exactly what it says. It is a diet that makes your body.
Oh, hey, there's another registered dietitian. Hi, lady. Here we go.
Yeah, she's speaking Portuguese.
Oh, Portuguese.
Yeah. It's so cute. She just loves her broccoli. So definitely, let's get back to that, our slide.
Look at her loving that broccoli. Her little face is so cute.
So cute. Whoops. We may have lost our video here.
I love how she licks her fingers too. She's just really
enjoying it. Loving it.
Yeah.
Hold on one second.
I wanted to give some examples of green while you're trying to find.
Me too.
So some of the green things besides broccoli would be like snow peas, watercress, the green herbs that you use, okra, which is a strange food, isn't it? Okra. We should have a whole thing about okra sometime.
It's a great food to encourage, and it's so hard we don't think about making it, but it's so good for our digestive system. It really can actually help heal the digestive system.
It's amazing because it has that that slimy component. I shouldn't use the word slimy. It's mucilage. Yeah, that's pretty good for you, isn't it?
It is.
Yeah. Let's see. You got it up, so carry on.
There we go. So this is, eat your broccoli. That's because it has the phytochemical sulforaphane, which is in a supplement, many supplements, DIM, diindole-3-methionine or I3C, and this has some hormone modulation properties and anti-cancer properties. It also contains carotenoids and isothiocyanate. And the sulforaphane component in broccoli, which is in the DIM or the I3C, actually helps induce detoxification of carcinogens. It helps to stimulate. Yeah, isn't that interesting?
Yeah.
It helps to stimulate our liver in particular and encourage detoxification. And it limits the production of cancer-related hormones. So it modulates some of the hormones and some of the bad hormones that we don't want in our system. It helps by stimulating the liver and healing that.
Can I ask you a quick question? I'm sorry to interrupt your flow, but I was thinking about, detoxification, and this is something you talk to patients about. And when you say detoxification, you really mean that you're supporting the liver?
Correct. A lot of times.
Right.
And all the organ systems. So the liver is one organ system that does promote detoxification, but our skin also, we detox through our skin, especially heavy metals when we sweat.
Interesting.
Stool is another way to detoxify by clearing out. So when I talk about detoxification in this context, yes, it's a little bit more about the liver, but when I'm talking with a patient about it, I'm making sure that all their organ systems that are involved in detoxification are breathing is another way of detoxifying, that they're working as they should, or if they're not working the way that they should, there's ways to promote specifically those organ systems, how to encourage them to detoxify.
Okay. Because that's one of the things that we talked about, in school at Bastyr in the nutrition program. We just talked about how we can't, detoxify someone. All we can really do is support their own detoxification systems. Exactly. And so when people do a detox diet, we as, in the dietitian program would be like, ha ha ha, what are they talking about? But it's just a language thing, really. It's about supporting those systems because we already detoxify ourselves. We have a whole, our bodies do that, but if we're ailing and we're not supporting those organs, then that's what that means. That's always a good conversation to have, I think, because it's nice to get specific about what that means.
Yeah, exactly. Thank you for mentioning that. It's a good point here. And then, just, we don't have to go into each of these different components. I like to mention sulforaphane as one, but you can see that they are inhibiting they're turning off our genes in certain areas. If they, to inhibit the cancer cell growth or inhibit over stimulation of certain immune factors, and improving our immune system as a result. So eat your broccoli for sure. All right. Okay. And then onions. Onions. So onions, I personally love onions. I love that they add so much flavor to our foods, and make things taste really yummy. And then they also contain some wonderful flavonoids. Glutathione, I'm just going to make a throw out to glutathione, which is probably one of my favorite flavonoids, antioxidants. Glutathione in particular actually helps with aging, the aging process. It's a phytonutrient that we need in our system, and the more glutathione you have, the better our telomeres are. We have a lot of anti-aging support in the body. And so onion is one of the few foods, there's actually very few foods that actually contain glutathione naturally. Yeah. It also contains quercetin. Yeah, what were you going to say, Laura?
Well, I was going to go probably into something we shouldn't go into, just about endogenous.
Let's go there.
Yeah. Well, I don't know if I can speak about it very knowledgeably, but isn't glutathione one of those endogenous antioxidants?
It is. Yep.
Right. And I just remember reading that our endogenous antioxidants are like maybe they're big in our body. So like one of them might be able to take out a whole like millions of free radicals, while if we eat something that we're just having 1-on-1 ratio in terms of fighting free radicals. Does that sound right to you?
Yeah, exactly.
So glutathione is awesome and excellent and huge.
Yeah, exactly. Yeah. So it's very hard to get glutathione as one of those endogenous antioxidants, to get it out of foods and supplements. There's really not a lot of ways to get glutathione in your system. But you can. There are certain ways to get glutathione in the system, but it's not that bioavailable when you do take it in exogenously. So from food, it doesn't absorb very well. Or a pill. It's not absorbed well in the gastrointestinal system. You have to bypass that first pass metabolism. So the GI tract, the mouth, all the way through the anus, you have to bypass that in order to get glutathione into the cells, into the body. And we do create it. We can create it as well.
So onions support that. And should you cook your onions? Or
I didn't hear what you said. Say that one more time, Laura.
I was wondering, should you cook the onions, or is it both ways that you get the benefits of glutathione? Because is it a fat-based thing?
That's a very good question. I don't know. We're going to have to do a little research there on what the best way is. Yeah, I'm not sure to get it from that food.
Well, that's exciting. Thank you.
Yeah, of course. So with these flavonoids, we know like the anthocyanin, which we talked about with the cherries, and quercetin, they may inhibit inflammation and therefore tumor growth. And they aid the immunity and boost the production of the detoxifying enzymes in the body. So it helps support pathways of detoxification and elimination, which glutathione absolutely does. And it helps actually with the dim molecule, the sulforaphanes as well. So there we go. So back in 460 BC, somewhere in Greece, Hippocrates said, let food be thy medicine and medicine be thy food. And that's so true, especially now, more than ever. And I know that you probably believe this to the utmost, and I do as well. And
that's what's so exciting about being able to work together, because I think our knowledge sets overlap, but you know, you've got more of the medicine piece. So it's really exciting to get to work together.
Yes, I agree. And so let's put it all together. So we gave you a lot of knowledge. We gave you a lot of information. We probably threw out a ton of terms that you maybe had heard before. And we're going to take all of your questions. We have plenty of time, but let's also put it together. Let's see what we just talked about, what it might look like for you. And Laura came up with this beautiful meal idea or menu idea for breakfast. Some things to think about. Laura, do you want to say anything with this?
Yeah, well, it's kind of fun to look at it and take it apart. We've talked about some of the elements that you can see here. These are 4 ideas for breakfast that would be considered anti-inflammatory, you know, dietary, qualifying. So, you know, this is bread with hummus and avocado and sliced tomato. Think about what you see in these breakfasts that we've talked about. I see avocado, there's tomato, hummus. We didn't touch on too much on legumes, but they're in there in the list.
Yep. They're part of those complex carbohydrates we mentioned just a little bit of, but it's part of that whole group of complex carbohydrates. Yeah. Right.
And then over here in the breakfast tacos, we mentioned turmeric. You could have a tofu, kind of a scramble with turmeric instead of eggs or with the eggs. Actually a great combination, tofu and egg scramble. And then you can have a mushroom.
Especially if they're the pasture eggs or from someone's chickens.
Oh yeah. That would be bright yellow. Yeah. Bright orange. So this is just an example. I feel like it's hard sometimes when you hear all this information to really nail it down to what it's going to look like and what you can eat and what you want to eat. That's always hard. So I really find it enjoyable to sit down with people and talk about what they like and how we can turn that into something that they can then follow, you know, long term.
Yep, exactly. And that's what you do a beautiful job with. All right. So just to review, postprandial review, hopefully your digestive system is starting to rumble a little bit. We're all thinking about lunch and what to eat that's going to support your immune system, that's going to follow an anti-inflammatory diet. So, you know, thinking about encouraging all those fruits and vegetables and some of those complex carbohydrates. Definitely eat your broccoli. At least that's my favorite. But also there's so many other good fruits and vegetables out there. And thinking about the foods to encourage versus the foods to avoid. So just encourage some of these foods that we talked about today. Maybe they're totally new for you. And if you're needing more support, if you're needing ideas on how to make this anti-inflammatory approach to your nutrition sustainable, how to get the most out of it and figure out a way to do it that may be right for you and your individual biology, pathophysiology, I just would encourage you to keep this conversation going and reach out to myself or Laura or any of our providers at Heart of Wellness. We all are here for you. And we're also here now to take some questions. And thank you all for participating. And we look forward to some of the questions that you guys have.
Yes, thank you so much. It's been really, really interesting. And thank you, Ashley.
Yeah, thank you, Laura and Dr. Morgan. You did such an amazing job. If anybody has any questions, you can type them into the chat, and Laura and Dr. Schuster will be sure to answer them. We'll give you a few minutes. And as Dr. Schuster mentioned, and Laura, thank you so much. We are ready to see you if you want to have an appointment with either these two or another clinician at Heart of Wellness. We are seeing patients over video telemedicine. We are still having inpatient appointments with we are screening people to be sure that we're doing our part in social distancing. And you can reach us at info@heartofwellness.org. You can reach out to us via our Facebook page on the Messenger. You can call us. Oh, thank you for flipping back to that slide. You can call us at 360-570-0401, and you're welcome to stop into the office. We're located in Tumwater, Washington at 205 Clark Place. Well, thanks, Chrissy. Yeah, so if we don't get any questions here, I think we ought to wrap it up. And
we did have a couple earlier. We could read those out loud, but I don't know.
Yeah, I was thinking about that. Great idea.
Yeah.
So how about I'll read the question, and then do you want to read the answer?
Sure.
Okay. Let's see, where'd it go? Do dried fruits like apricots have the same fiber content as fresh?
And my answer was yes, because the fruit is just a more concentrated form. Like it's just the liquid is gone, but it's really important to drink enough water along with that dried fruit, and then also keep in mind that it's a more concentrated sugar. Mm-hmm. Do you have anything to add?
I do. So I actually have a trick. So my background is also in Ayurvedic medicine. So they talk about dried fruits quite a bit, interestingly. And one thing to even consider if you're having a hard time, getting fresh fruits and vegetables, or if you like, you like the dried fruits, soak them. Because if you soak them even overnight or just for a little bit, it's going to absorb some of the water content. But you need the fiber, you need the different fibers that are in fruits and vegetables and the mucilage as well as the water content in order to promote a good bowel movement. That's a trick. Yep. So soaking the fruits and vegetables that are dried.
Okay, thank you. Yeah. How about, do fruits and vegetables go together well? Like how on the Canadian plate they showed us a pile of fruits and veggies together, or are they better separate?
And my answer was, that's a great question. I think that's been a discussion all through time immemorial or whatever. But our bodies are generally able to handle them together. Our digestive systems are used to, taking what they get and doing it in their different areas and places. But some bodies are different, and there may be that there's a deficiency in one area or not. And so if you experience bloating or indigestion after eating fruits and vegetables together, then it's a good idea to see if you feel better eating them separate and take notice, and then maybe go ahead and eat them separately until you can figure out if there is something going on. What do you think, Dr. Schuster?
Yeah, I think that's a great explanation. I think that it depends also on some of the fruits and the vegetables, and then how you prepare them. But like you said, it's see how you feel. If you're feeling gassy or bloated after eating it, you maybe not digesting or absorbing it as well as you should, and then that's a different conversation to have. But yes, generally speaking, it can be combined.
Do you think there's certain foods that you would really watch out for in those terms?
Oh, fruits?
Or just foods that generally don't go well together, or things that cause more trouble in patients that you've noticed?
Ooh, that's a good question. I mean, the issues that I see for patients actually is more of the breakdown of the larger molecules, the protein molecules. Like I said earlier, that they have a harder time breaking down certain proteins. And proteins are found, like we said, in complex carbohydrates, but also in meats and dairy. So I don't see people have as many issues with the fruits and vegetables as they do with some of the proteins. However, some people have issues with some of the fibers that are in the fruits and the vegetables, especially if you have more of an IBS type picture.
Right. That would be more in the lower GI than in the upper.
Here's a new question. Are there some veggies that you can grab and go that will cause less bloating and gas than others?
You want to take this one, Morgan?
Well, so my approach with that would be cooking some of the fruits and vegetables, especially if you're feeling gassy and bloated from the raw ones. So just, lightly cooked, lightly steamed carrots potentially, and or broccoli if you're having some of the gas and the bloating from it. That's what kind of comes to mind first. But because those are easy to grab and go. Celery is pretty, depends, celery can be pretty benign and not cause as much gas or bloating. But cooking, I think, at least my thinking is with cooking with some of those foods.
And that's a really good thing to think about. It didn't even occur to me to suggest cooking. I was thinking about that if you chew your food really well, that's a really good way to prevent gas and bloating. And so maybe it means like cutting up your carrots into little tiny matchsticks and just really eating a little slower. Because I think a lot of us tend to wolf food down without noticing, like in the car. I do this all the time. I just grab something and bring it in the car and just eat it while I'm driving. And it's nice to just have a little, just slow down, chew a little more, let your salivary glands do their job and put those enzymes into your food before you swallow them. That's another way to do it. So I wouldn't say that there's some that are more or less. It really depends on the person.
And it depends on the setting and the situation and the environment. So
true.
It may not be simply the fruit and the vegetable, but it may be the environment that you're eating in and the fact that you're eating on the go and you're rushing and you're not focusing on your food and you're not allowing for those digestive enzymes to be secreted to help support you to break down those foods. And that really is a good point to make.
Yeah.
Good question.
Well, shall we wrap it up?
Yeah. Let's
Thank
do
you
it.
both
And
for
enjoy
being here today.
Yeah, thank you all very much. It's been really fun.
Yeah.
Thank you, Dr. Schuster and Ashley.
Thank you, Laura and Ashley.
Yeah. And so anybody watching today, you can let your friends and family know this will be put up on our Facebook page for time memorial, and you can watch it as many times as you want and share it with your people too.
Great.
All right. Thanks, everyone. Bye.
Bye. Take care.